What should you do when you sprain your ankle? Should you ice it? Should you use heat? Should you rub it? Should you walk on it? Should you see a doctor? The answer is probably all of the above. So the first 24 to 48 hours is when you want to rise your ankle, which is to rest, ice, compress and elevate it. And the reason why you want to do this is because right after an ankle injury, there might be bleeding, inflammation and a lot of pain in the area which you want to stop as soon as possible. After 24 to 48 hours, there is usually no more need to ice it as any bleeding or swelling would have already stopped. Instead, this is when you start using things like heat, acupuncture, light massages, medication, exercises, etc. to increase blood flow to the ankle joint and start to promote recovery. But having said that, ankle sprains can be anywhere from mild to very serious. So if your ankle sprain does not go away after a long time or if it's very painful after you sprain your ankle, then it's best to go and see a doctor straight away.